polio is another example where it seems to be on the rise, and it's a virus that can cause paralysis. So there's definitely a possibility for healthy adults to get very sick if they're not vaccinated.
Welcome to the Bronx Health REACH Community Coalition podcast. I'm Mariah Bernzaloff, and I am hosting today's podcast. I'm the program manager of the Adult Vaccine Initiative at Bronx Health REACH, an 80-plus member community coalition launched in 1999 to eliminate racial and ethnic health disparities in the Bronx. In response to recent changes in the vaccination schedule policies and the list of approved vaccines, Bronx Health REACH brought together a group of distinguished experts for a panel discussion on July 30th to address concerns many community members had about access to affordable vaccines, vaccine ingredients, common myths, and other related issues. One of the panelists, Dr. Maria Gervits, is the Director of Family Medicine Obstetrics Services at the Institute for Family Health. She trained at Albert Einstein College of Medicine and Montefiore's residency program in social medicine, where she also did a Family Medicine Obstetrics Fellowship. Dr. Gervits spoke about how MMR, RSV, COVID-19, and the flu vaccines can affect a baby's development during pregnancy. She also explained the safety of ingredients found in vaccines like aluminum salt, thimerosal, and mercury. Dr. Gervits, what are the most common concerns you are hearing from pregnant and breastfeeding women lately about vaccines, and what do you tell them?
So mostly the concerns are about safety, whether the vaccines are truly needed, particularly in pregnancy. Patients worry about the effect on the baby's development and, in utero and also after birth. They're often more willing to get the vaccine after pregnancy. There's less concern regarding lactation that I've heard. Because of how quickly the COVID vaccines came out, that they're different than other vaccines, being mRNA vaccines, and the way some members of the media and the government showed distrust of these vaccines, patients are particularly hesitant about the COVID vaccines. Our vaccine rates in pregnant and lactating patients of COVID vaccine in particular are pretty low. I try to reassure patients that the vaccines are being offered in pregnancy because they're safe in pregnancy. Otherwise, we wouldn't offer them. Educate patients that the risk of not getting the vaccine can be great because they might get the disease or the baby might get the disease because they're not protected. And some examples of that include like the COVID and flu vaccines, which can prevent hospitalization and death in pregnancy and miscarriage, and the tetanus vaccine, which we give in the third trimester to the pregnant person so that they develop antibodies that go through the placenta to the baby and protect the baby in the first few months of life, particularly from whooping cough.
Have you found, so COVID is the one that you've seen the most resistance, COVID and flu?
Yeah.
Do you happen to see any patients who haven't gotten the measles shot, who are resistant to getting the MMR after pregnancy, obviously?
Right. There's always some resistance, though a lot of patients have gotten it at some point as children. And so I can kind of show them their vaccine record from when they were children and say, well, you've had this vaccine, you didn't have a bad response. And that can reassure them that they can get the vaccine. But there's certainly hesitancy about all vaccines, but particularly COVID and flu.
Thank you. Are you getting more questions about ingredients in vaccines, such as aluminum salt or thimerosal or mercury lately?
Patients in my community tend to have more vague concerns that vaccines might not be safe, don't always know the particular ingredients that have been cited as concerning by vaccine hesitant groups. But if it does come up, I can tell them that thimerosal is safe at the doses that's present in vaccines. The American Academy of Pediatrics and the World Health Organization agree that the thimerosal containing vaccines don't cause autism or any neurological conditions in children, and the benefit of vaccination outweigh any theoretical risks. And there's no evidence of harm from thimerosal that's present in vaccines. And aluminum salts are included in some vaccines because they're very safe and effective in enhancing the effect of these vaccines. So the body actually responds to the vaccine better and creates stronger immunity to the disease with the presence of aluminum salts. And they've also been shown to be safe and effective.
Great, thank you. Did the recent news about vaccine schedule changes affect your patients' decisions about vaccinating at all?
So the news is still pretty fresh, and most of my patients are underinsured or uninsured, with many whose primary language is not English. So their focus is less on news and politics and more on, taking care of their families. But I think over time, as this news becomes more common knowledge, it's likely to affect patient decisions in the future.
If there aren't any more comments, I wanted to move on to the Q&A and see if there's anybody in the audience that wants to ask any questions.
At the time when we found out it was a kind of like COVID and flu fatigue, we extended to more talking about hepatitis and measles and others vaccine, Tdap and all that. But lately, what I encountered after we did a few presentations, a few outreach in the community, some of them are come up to me. We had an event that I went there, but they was telling me that they have a concern about the HPV vaccines. But most of them, they never did it because it was a rumor in some places in West Africa where they had vaccination and they had a rumor that the HPV vaccine was something that might create a fertility, like a deficiency on fertility with them. So they were scared to take it. But they had realized, well, most of them, when they went with their kids at the hospital, they say with no consentment, they gave them the vaccine. They gave them the vaccine of the HPV without them even knowing. So they were concerned. They came back to me. Is it safe to take the HPV vaccines? And I had some men asking me. They heard men can take HPV vaccines. So they were asking if it's something they need to take the HPV vaccine. They have a concern about it.
I can talk about that.
Okay.
So the HPV vaccine is preventing infection from HPV, particularly strains of this virus that causes genital warts and cervical cancer. So it's pretty much the only vaccine we have that prevents cancer, which is really incredible. And it's decreased so much the rates of cervical cancer and young women dying of this cancer. And yes, it can be given to men, women, and children starting at 9 years old and up to 45 years old. It's very much recommended and it's very safe. So I would respond that yes, this vaccine is safe and I definitely recommend it. Part of the issue is that it's not required by schools, so it's not one of those vaccines that the school pushes for. So a lot of parents hesitate to give it because it's not required. And there's also some fear in certain communities or distrust, concern that because the HPV vaccine is a sexually transmitted vaccine, some parents worry that giving the vaccine to a child who is not yet sexually active will make them feel like they can become sexually active or put ideas in their heads, but that's also not true.
But
Thank
it
you.
doesn't cause fertility
Oh,
problems.
yes, it does not.
Okay.
Thank you.
Would it delay like menstruation or?
No, absolutely not.
My question is, it is common for healthy adults really get sick with viruses preventable with vaccines? It is common for healthy adults really get sick with viruses preventable with vaccines?
Yeah, so the short answer is yes. If an adult is not vaccinated, they can certainly get a disease. For example, there's been measles outbreaks, and measles can be fatal. Also, all sorts of other infections that we vaccinate against, like I mentioned, HPV, which causes cervical cancer. Someone could get very sick from cervical cancer. In the US, a lot of people are vaccinated, which creates herd immunity, which I'm sure a lot of people have heard of through our experience with COVID, where if everyone around you is vaccinated, then you're not going to catch the disease from them. But more and more people are declining vaccines, and so that herd immunity is decreasing. And also folks who want to travel outside the country to places that have lower vaccination rates because of a lack of availability of vaccines, can get very sick. Polio is another example where it seems to be on the rise, and it's a virus that can cause paralysis. So there's definitely a possibility for healthy adults to get very sick if they're not vaccinated.
To find out where you can get vaccines in New York City, visit the NYC Health Map. If you would like more information about vaccines, visit our webpage at institute.org/vaccines saves lives.
You've been listening to the Bronx Health REACH podcast. You can email Bronx Health REACH at bxhealthreach@gmail.com. You could find Bronx Health REACH on social media. For Facebook, Bronx Health REACH. For X and Instagram, BX Health REACH. And on Blue Sky, bxhealthreach.bsky.social. The views, thoughts, and opinions expressed and presented by our guests here on the Bronx Health REACH podcast are their own and do not necessarily represent the views, thoughts, and opinions of Bronx Health REACH and the Institute for Family Health.